Welcome, everyone, and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome our guest today, whom I will shortly introduce. I am Leonela Ocampo, a member of the Community Pharmacy Section EXCO, and also a member of the FIP Data and Intelligence Commission. Currently, I am the president of Asia Pacific Institute for Medication Management, while formerly a president of the Philippine Pharmacists Association. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. We are pleased to be delivering this event, episode number 17 of our program of 17 events on self-care, shaping the future of self-care through pharmacy. As healthcare providers, pharmacists have an important role to play in supporting self-care. This program was composed of 8 episodes that refocus on accelerating universal health coverage for all by enabling self-care through community pharmacy. And additionally, 9 episodes focused on self-care support for community pharmacy teams. Today, we will be exploring support self-care in sexual health. This is an event that would have members of the panel who would talk on different topics that we will definitely be getting very good learnings from. Please note that this event will be recorded, live streamed on FIP, YouTube, and will be available at www.fip.org. To all those listening, please feel free to send your questions through the questions and answer box, and we will be picking those up throughout today's session. Let me first, before I introduce our panelists, give these announcements. Chris, can you please get back to the previous slide? The webinar is being recorded, as I've mentioned, and live streamed via YouTube. The recording, also as said, will be available on our website, and you may ask questions using the question box provided. You are welcome to provide feedback to webinars@fip.org. Now, let me proceed to introducing our panelists. Our first speaker today is a lady who is a community pharmacist from Spain. She started studying pharmacy by chance. She had always wanted to be a teacher, but her father didn't approve for that. Pharmacy subjects immediately drew her attention, and after 5 years, she fell in love with pharmacology, physiology, and everything related with healthcare. She also got the qualification to work as a hospital pharmacist, but the closeness with patients is her raison d'etre. She had worked in several drugstores and specialized herself in pharmacological monitoring, autoimmune diseases, and sexual health care. Now, she worked as a pharmacist in Seville and combined it with her education in some schools, podcast, and organization. She also had enrolled a project called Adjutant, owned by are RICO FSA and had provided opportunities for improving her professional skills. Finally, she thinks she could blend her vocation for teaching with her passion for healing. So, our dear audience, help me welcome our first speaker, pharmacist Irene Serrano Garcia.
All right. Good morning, everyone. My name is Irene, and I work as a community pharmacist in Seville, Spain. First and foremost, I would like to thank the International Pharmaceutical Federation for the opportunity to be here with all of you. And also, I should like to extend a word of thanks to the official School of Pharmacists of Seville. And now, let's go through this chat called Common Sexual Health Issues. John, Chris, can you pass this? Common sexual health issues pharmacists face day by day in our work. Next. What is sexual health? The definition given by the World Health Organization in 2006 says it is a state of physical, emotional, mental, and social well-being in relation to sexuality, and is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach for sexuality and sexual relationship, free of coercion, violence, and discrimination, as well as the possibility of having pleasurable and safe sexual experience. Viewed holistically, it depends on the fulfillment of certain human rights, and it's also relevant throughout the lifespan of individuals, not only to those in reproductive years, but also both to the young and the elderly. Next. As we have briefly seen, sexual health plays an important role in our lives, and pharmacists have something to say in this subject because we are the link between three bases: patients, medicines, and primary healthcare. According to a survey occupied in 2020, patients interviewed affirmed they visit community pharmacies approximately twice as frequently as they visit primary care office. We establish a close relationship with patients based on trust and familiarity. In fact, a lot of doubts have been solved during these 2 years of COVID-19 pandemic in relation to sexuality issues. Pharmacists are responsible for the quality of medicine supply, ensuring this supply is within the law, and what's more, ensuring the medication is suitable for the patient, and also advertising patients about their medicines, how to take them, what reactions may occur. Ideally, we have to collaborate with doctors in terms of promoting health and, why not, taking part or participate in programs of lifestyle changes. Next. If one of these pillars fail, we could start with a sexual dysfunction. Sexual dysfunctions are a heterogeneous group of disorders typically characterized by a disturbance in a person's ability to respond sexually or to experience sexual pleasure. The Diagnosis and Statistic Manual of Mental Disorder, released by the American Psychiatric Association, divide sexual dysfunction in male or female, and we find 4 categories: desire disorder, arousal dysfunction, orgasmic disorder, and sexual pain disorder. Have you ever heard about early ejaculation, genitopelvic pain? Surely you have. But in our community pharmacies, which are the most common sexual health problems? Well, in this review, we are going to deeply see these top 5. And let's start with erectile dysfunction. ED is the inability to get or keep an erection firm enough to have a sexual intercourse. And how does an erection work? Well, when a man is aroused, the nerves around the penis become active. The muscle relaxes and more blood flows into this organ. This additional blood makes the penis stiff and hard or erect. And let's see some statistics. Look, 1 out 10 men worldwide are suffering from ED, and surprisingly, 50% of all men who have diabetes are also dealing with this condition. So, next, Chris. There are many reasons that can lead to an erectile dysfunction. The vast majority is due to vascular conditions, hypertension, obesity, high levels of cholesterol, but also taking some medications like antidepressants or diuretics. And the abuse of alcohol could also pull the trigger and induce to an erectile dysfunction. So let's see the treatment. The treatment of erectile dysfunction includes oral drugs, vardenafil, sildenafil, tadalafil, pharmacological known as the phosphodiesterase 5 inhibitors, medication that inhibits the action of an enzyme typically presented in some blood vessels. When low levels of testosterone are detected, testosterone therapy may be suitable for those patients. And if a man is dealing with another chronic disease like hypertension, the intracavernosal or the intraurethral therapy may be the best option for him in order to avoid the side effects of oral drugs like headache, nasal congestion, flushing, and to avoid incompatibilities between medications. Next, Chris. Second issue, female sexual arousal disorder. Kind of an easy name, isn't it? Well, this is the inability a woman has to respond to sexual stimulation. This disorder also includes pain during a sexual intercourse, inability to reach orgasm, and lack of desire. And I think it's important to name it because for more than 40% of women are struggling with this condition in the present time. The diagnosis has to be diverse. A blood test has to be ordered to check the appropriate levels of hormones, the performance of a pelvic exam, and also discuss with the physician the sexual and medical history of the woman. Next. Psychological and social causes can induce to this disorder. Periods of anxiety or depression, long-term stress, history of sexual abuse, above all in childhood, and long-standing conflicts with a partner. But also physical reasons like medical situations, cancer, a heart disease, and some medications. Do you know that antihistamines increase the risk of vaginal dryness? Vaginal dryness could lead to painful sexual intercourse, and this can lead to an female sexual arousal disorder. And obviously, and of course, hormonal reasons, lower estrogen levels after menopause and after giving birth and during breastfeeding because there are high levels of progesterone and low levels of estrogen. Next. The ideal treatment is the combination between medication and non-medical habits. Medical treatment includes the estrogen therapy that improves vaginal tone, increasing vaginal blood flow and enhancing lubrication. But also, when low levels of testosterone are detected, androgen therapy may be the best option for that woman. Ospemifene, which is a selective estrogen receptor modulator. It acts the same way as a natural estrogen. And flibanserin, approved by the Food and Drug Administration in 2015, it is used in low sexual desire in premenopausal women. It was originally developed to treat depression, but it didn't work for it. Non-medical treatment includes the use of a water-based lubricant to improve vaginal dryness. Why not use a sexual device in order to own your body? And it's highly recommended in cases of dyspareunia. And practicing healthy lifestyle habits, sun-based to boost levels of vitamin D, workout, and not smoking. Next. Third condition, vaginal yeast infection, commonly known as candidiasis. This is the infection inside the vagina caused by the growth by a type of fungus called Candida albicans. Symptoms include vaginal itching, pain during sexual intercourse, burning sensation during urination, and an abnormal vaginal discharge, typically characterized by bad smell like rotten fish and a gray or yellowish color. So, next. Antibiotic treatment is the main reason of candidiasis, and it is because the lactobacilli normally present in the vagina produce substance and a level of acidity that inhibits candida to overgrow. Antibiotics kill these friendly bacteria and enables candida or this type of fungus to produce this condition. Despite the fact a vaginal candidiasis is not a sexually transmitted infection, candida can be transferred while having sex. So, the use of a condom or a dental dam when having anal, vaginal, or oral sex do protect against candidiasis. Now, let's go into see the treatment. The treatment is based on antifungal medication that can be oral in serious cases or topical. For example, the use of clotrimazole in form of vaginal tablets or external cream. And prevention tips are so useful in case of recurrent candidiasis. Avoid the use of vaginal deodorants. Avoid the use of stretched clothing. It's preferable to wear cotton underwear. Don't douche because it can damage the microbiota. Take food supplements rich in probiotics and vitamin A. And of course, use an appropriate intimate gel. Next. Next one is the human papillomavirus. HPV is the most common sexually transmitted infection. There are many serotypes of this virus. Some of them are low risk, clinical associated with genital warts around the vagina, anus, or penis, and high risk ones that are always isolated in cervical cancer. The transmission is by having sex with someone who has the virus. A person can be asymptomatic, so this virus can be passed even when an infected person has no signs or symptoms. So, the diagnosis and prevention are fundamental. Within diagnosis, we find the pap smear, the DNA test, and the biopsy. And let's talk about the pap test. This is a screening procedure for cervical cancer. During this routine, cells from the cervix are gently scrubbed away and examined to detect an abnormal growth. This routine is doing at the doctor's office, and it might be mildly uncomfortable, but it doesn't cause any long-term of pain. People also can do several things to lower the chances to get HPV. Get vaccinated. The human papillomavirus vaccine is safe and effective when given in the recommended age groups. It do protect against diseases caused by this virus. In some countries, like in Spain, this vaccine is funded by our primary healthcare assistant in girls between 9 and 12 years old. Use latex condom the right way. Latex condom do protect against the human papillomavirus, but the effectiveness is not 100% because there are areas that the condom do not protect. And obviously, limit the number of sexual partners or be in a monogamous relationship or only have sex with someone who only has sex with you. Next. And last but no less important, we are going through contraceptive methods. Contraception is the use of methods or device intentionally to prevent pregnancy. And amazing, in 2019, 56% of all women in the reproductive age range were using some form of mother contraception. So, which is the most appropriate method? It is the one chosen by the patient and the gynecologist, and it has to be safe, I mean with few side effects, effective, available, and also affordable for the patient or the primary healthcare assistants, and well tolerated. All this guarantees a correct adherence to treatment. Next, Chris. There are a wide range of contraceptive methods we can find in our community pharmacies. Barrier methods that prevent contact between the egg and sperm. Condom, female condom, sponge, diaphragm. The natural awareness method that are based on the knowledge of the period or monthly bleeding. Calendar method, Billings method, and also we find hormonal contraception, oral contraception, the ring, the patch. All these release an amount of hormones into the bloodstream. And long-acting contraception, injection, implant, and the IUD or intrauterine device that can be hormonal or copper IUD. Next. Some highlights of contraception. Abstinence is 100% effective if it's truly followed. Natural methods are free of side effects, but effectiveness depends on women. Barrier methods do protect against sexually transmitted infection. Syphilis, chlamydia, combination pill is also used in the treatment of numerous diseases. For example, polycystic ovarian syndrome. This is a condition in which the ovaries release a large amount of androgens. Well, the combination pill is right now the only treatment available for treat signs and symptoms like dysmenorrhea or heavy bleedings of this pathology. And the IUD, which is the most permanent, reversible birth control device. It can last up to 7 years. Next, please. And despite the fact emergency contraception is not a contraceptive method per se, we have to talk about it because in our pharmacy, we receive a lot of questions about this. And we have to say that emergency contraception is used for prevent pregnancy in two situations: after unprotected sex or when the contraception method has failed. And there are two types: the morning after pill and the copper IUD. The morning after pill can be made of levonorgestrel or ulipristal, and both of them avoid ovulation. Meanwhile, the copper IUD release copper, which is a toxic substance for sperm. Next. To sum up, I want to finish with a reflection. September the 4th is the World Sexual Health Day, and in the previous campaign, the slogan was "Your sexual health matters," and indeed, it matters. Pharmacists will always be right there to back up our patients, improving their self-care, comprehension, kindness, health education. Our patients deserve it. And here in Spain, during the lockdown, pharmacists, we said, "La cruz verde de la farmacia no se apaga." And I totally believe in that because, as Martin Luther King once said, it is not how long you live, it is how long you live well. Thank you.
Thank you very much, Ms. Irene. Let me invite my fellow pharmacists to be one with me in thanking Ms. Irene for a very insightful discussion of the topic assigned to him. Now let's proceed to our next speaker. Our next speaker is the president of the Egyptian Organization of Pharmacy. He is the General Secretary of EMRO-Pharm Forum, member of the steering committee. He is an executive committee consultant in School of Pharmacy, Al Sharjah University, Emirates, a mentor in FIP Pharma Bridge Project, and a patron in Live Well Initiative Organization in Nigeria. Teaching in School of Pharmacy is a passion of our speaker, and is teaching actually in Galala University, Egypt. Our speaker, Dr. Wael, has more than 22 years of experience in the pharmacy profession, including community pharmacy, hospital pharmacy, military and emergency pharmacy, social and administrative pharmacy, and clinical pharmacy. To discuss to us, sharing his expertise on the topic, appropriate preventive measures and choice/use of treatments for sexual health, let us all welcome our speaker number 2, Dr. Wael Ali.
Thank you so much, Rina, for this introduction. Thank you so much. I'm so happy to be with you today, and thank you for attendees. And I hope my presentation, it will be short and very persuasive. Thank you so much. Let's start from today. We are talking about appropriate preventive and the choice use of sexual health. Is it correct to say only sexual health, as we are as a pharmacist or healthcare profession? Is it right to say only sexual health? That's it? Here, it's not. Next, please. Right now, we have to say sexual and reproductive health and rights. This is a very wide expression. We use it over the world, especially WHO and FIP, sexual health and reproductive health. It's kind of like you have to say it's like adjacent, sexual and reproductive rights. Next, please. SRHR, sexual health rights. It's like a concept of human rights applied to sexuality and reproduction. It's a combination of 4 fields. It's not only like one field. Next. Yeah, so it's number 1, sexual health. Number 2, sexual rights. Number 3 is reproductive health. And last one is reproductive rights. Next, please. So this is including like a sexual health information and caring for adolescents, women, and sexual minorities. Next, please. There is a major gap in the sex health definition. If we'll say, for example, in Egypt here, what the definition of the sexual health, and if we'll ask someone in America the same question, and if we'll ask someone in the Asia the same question, you will find definitely the different solutions or different definition of the sexual health. So the education and the training for the sexual and reproductive health and rights among, we are the healthcare students of the pharmacists, young pharmacists, and even all pharmacists, improving access to sexual and reproductive service in Africa and America and over the world, from Africa to America. Next, please. So we are, as pharmacists, you know, I love to say that medical doctor, you have to knock his door to say, hello, please, can I enter? But the pharmacist, please push the door. You will find that in our pharmacy, you know, just push the door. But in the clinic, you have to say, knock the door. So here, the information in the pharmacy, it's very public. It's very easy to get information from the healthcare as a profession. Next, please. So our goals to make a bridge knowledge gap in education, training sexual and reproductive health rights among all students, young pharmacists and pharmacists for the sexual reproductive health services from Africa to America to Asia, to make like one definition and one concept, sexual and reproductive health. Next, please. So first of all, we have to know what the meaning of SHRH, as I told you that before. It's this definition, it's not well definition. This definition is WHO definition. So it's like a standardization over the world. We are, as a pharmacist, we have to know this is a definition of sexual health and reproductive health. So this is a reproductive health, adolescent health, maternal health, contraception, sexual transmitted diseases, abortion, GBV or gender-based violence. It's very important to know that. Female genital mutilation, access to reproductive health, child and forced marriage, men's reproductive health. Next, please. So I will give you like an example. What is the role of the pharmacist in the sexual and reproductive health? For example, here in maternal health and rights, maternal health promotion, this is like a national and global process. For example, in WHO, in FIP, we are talking about maternal health promotion, sexual transmitted infection in the pregnant, especially pharmacist promotion, maternal health, GBV, and even the COVID-19 time. Next, please. So why maternal health is so important? I'm talking about the maternal health is a key to saving lives of more than 1 million women who die as a result of complication from pregnancy and childbirth each year. So you can imagine with me, we are at the pharmacy, how many pregnant women we meet today or every day. You know what I mean? So you are, as a healthcare profession, as a pharmacist, you will find yourself as a protector for like millions of these pregnant women over the world each day. Next, please. So maternal health refers to health to women during pregnancy, childbirth, and postnatal periods. Next, please. For example, I will give you like a very simple example as UTI. can make a very bad problem from the pregnant woman. Mental health conditions. You know, I will tell you about the maternal health. The pregnant woman can suffer from the mental health. She can kill herself and her baby. Hypertension, obesity, severe bleeding. So it's kind of very little bit symptoms, but actually they can be, you can save a lot of pregnant women and their babies. And here, let me discuss something. The role of the pharmacist, especially from this part of world, from the Middle East countries, and you will find the pharmacist, he acts as a medical doctor, especially in the medicine or the family medicine doctor. Yes, we are here in this area of the world. The people, they start first from us to discuss what the problem they are suffering from. So you can meet a lot of pregnant women, they are suffering from UTI, and she is pregnant, yes, but she is suffering from UTI. Yeah, it's no problem, just take this and you will be very good. No, please don't do that. If you are a pharmacist and you will find like a pregnant woman, for example, yes, this is sexual reproductive health. It's very important. I'm not talking today to what about the medicine to get the well-being, have a sex, or what about these medicines and what about this feeling. I'm talking about how to save people, how to save the human issues. Next, please. So WHO here, I'm talking about something that's very important. The first time I heard the expression in UK, his name is Dr. Pross. He told me, well, I want to tell you something. He's our colleague, a pharmacist. He told me, we are suffering from, look at this, untruth ocean. I told him, what do you mean about untruth ocean? He told me, well, every day we get our information from social media, from the people surrounding us. I told him, yes, it's normal. He told me, yes, it's normal from the normal people, not for healthcare profession. I told him why. He said, because you have to know 90% of this information, it is untruth, because you don't have like a reference for this information. So it's untruth. So if you are like only one ask about anything and get information, it's okay, but you are healthcare, you are a pharmacist. So you have to know something, it's very important. What this? If you will get information, you have to check, is this information is good or not? This information, it's reliable or not? So how can we get the reliable information in the sexual and reproductive health? The answer is from here, from number one, WHO. So it plays a fundamental role on increased awareness of maternal health and even sexual and reproductive health. Next, please. So they did, like International Day, WHO webinars, WHO UNICEF statements. They did it for the sexual and reproductive health. Please get back to this information. It's a very reliable information. Next, please. As we are in FIP, next, please. FIP plays a very good role in this reliable information. So in 2013, they did newborn and the child health. And in 2018, they did pharmacists supporting women and responsible use of medicine and the community pharmacy service pregnancy and breastfeeding. Next, please. So this is the goals of FIP. Next, please. How to make us as a one umbrella, one FIP development goals. Next, please. So this is number one, we have to have academic capacity to get the reliable information and academic. Next, please. Second thing, early training strategy. So early career training strategy, as I told you, from the student and from the early career pharmacists, it's a very important in this issue. Next, please. Advancing integrated services. We are healthcare profession, and we have physician, and we have nurse. So we will be like a first step in the treatment of this prospective patient. Next, please. Working with others. Next. Continuing professional development strategy, and it's very important. Don't stop in this information, please. You have to collect and to get a lot of reliable information from, as I told you that before, from my WHO, FIB, and my reliable colleagues and the professors. Next, please. People-centered care. Next. And patient safety. It's very important, as I told you, in maternal health. Next, please. Digital health, and this is a very important issue. We don't need to meet each together like a face-to-face meeting, like a face-to-face conference, but right now we are digital health. We are working digitally. We don't need to collect all of those people from the overworld. We have only one, as I told you, FIP, and the FIP reliable information. Next, please. So I'm talking right now in the pregnancy. I'm so sorry, because I got already the Omicron since like 4 days, but I never apologize. I have to be with you, so I'm so sorry if my voice, I have a problem in there. So I'm so sorry. Okay. Anyway, so this is STI during the pregnancy. When I'm talking about sexual transmitted diseases, I'm talking about you have to make it like a patient profile. I'm not only the pharmacist, you have to take this medicine and dispensing this one. No, you have a very big role in the public health. In the public health, you can stop like millions of the diseases over the world. Yes, you can stop death over the world if you will get only like a real advice for your patient. As I told you in the pregnancy, she is suffering from UTI, urinary tract infection. You can say, no problem, just get this medicine and you will be very okay. Please don't do that. Please don't do that. It's very important to do this. So you have to know the sexual transmitted diseases like a hepatitis B, chlamydia, like a syphilis, like a gonorrhea, like a hepatitis B, and this we are talking right now about the hepatitis C. Maybe it's like a sexual transmitted diseases. Next, please. So next, please. Next. So other effect of the sexual transmitted diseases in your baby. Oh, so the sexual health here, it's not stop in you and your partner. It will be go to your babies. Yes, like eye infection, pneumonia, blood infection, brain damage, blindness. No way. Yes, it is. Deafness and chronic liver diseases. Yes, it is seriously, as I told you. That's why I told you I'm not talking about only medicine as a sexual health, and we feel very good, very happy. But what about all of these things? You have to put it in your mind when you face any problem like this. Next, please. So right now, I'm talking about something. It is, if you will say gender-based violence, you will tell me, well, we are talking about sexual health, man. Why are you talking about GBV? I will tell you, please. As I told you that before, WHO, when you are talking about sexual health, we are talking about sexual and reproductive health. And this is a subtitle. It's very, very important to know this as a pharmacist. GBV harmful acts directly to individuals based on their gender. In our communities, especially for females, they suffered from GBV. Yeah, it's a human right thing. Next, please. So psychological violence, it's not only like a push. No, it is physical violence, forced marriage, sexual violence, female genital mutilation, forced abortion, and forced sterilization, and sexual harassment. This is a kind of subtitles of sexual health and reproductive health. Next, please. Women are disproportionately harmed by GBV. You know, according to United Nations population, each 1 in 3 women has experienced physical or sexualized violence in their lifetime. So you are, as a pharmacist and the healthcare profession, you have to know that. So you will face a lot of patients. You know, each 3 women get in your pharmacy, you will find 1 from them suffering from GBV. You know what I mean? Each 3 women. So if we will meet, for example, 30 women, you will get 10 women suffering from this GBV. Yeah, it is diseases. Yeah, it is. You have to know that. Next, please. So how can GBV violence be prevented? Prevented starting from you. Educate yourself and educate about the people around you. Use your voice on social media. Sponsor women survive of conflicts. Next, please. Right now, finally, I'm talking about the medicine. Look at this. I'm a pharmacist, but I'm talking about 75% as advisor and only 25% as a medicine dispenser. Yes, this is your role as a pharmacist. This is your role as a healthcare profession. You need, like in the sexual health and reproductive health, SHRH, as I told you, you need 75% of your time dedicated for advising and 25% only for dispensing medicine. Next, please. The dispensing policy of the sexual health medicine are vastly different between the countries over the world. We have a problem here in Egypt, not in Egypt, in the Middle East. Okay, I want to tell you something. You know, in a lot of countries in the Middle East and Africa, we can dispense whatever we want. You know, it's not kind of only OTC. All products, all medicines is OTC. So if anyone asking me, hey, I have a problem in the sexual end, yes, and I gave him, okay, no problem, just to get the Viagra, Cialis, whatever you want. It's fairly to do that. And it's a very big mistake. Very big mistake. I believe in that. You know, it's kind of powerful of the pharmacists in this area of the world, but believe me, it's so bad because I don't know what about this patient, what about this history. He has a very problem in the cardiac problem. They have a hypertension, whatever, you know that, but actually this is a fact. But in America, for example, or even in Europe, if you will someone get, hey, I want a Viagra, you will tell me, no, I can't dispense this. You have to give me the prescription from your physician. You know that, right? But actually in America, even, this is like a black market. I know that, you know, they will find it in the gas station stores. They can, you know, sell this kind of medicine for the 1 day or the tiger or whatever they do it. But it's FDA, they fight this problem. But especially this is kind of medicine, you will find it everywhere. So as a pharmacist, we have to believe in that. The OTC products in the sexual health, it's a very bad habit for any pharmacist. They can do it. Believe me, okay? But don't use it like a kind of get a lot of money, more money. You know what I mean? So you have, next please, to do that. We have to help the Pharmacists Association and authorities in these countries to set a group of law to regulate the sexual health medicine dispense. So wherever you are, we are right now more than 200, or they will see this, they watch this presentation, 1,000 from your country. Please push the people to regulate the sexual health medicine dispense. It's very important to do that for your health and your family health. Next, please. So by the end of this presentation, you will get very big thank you, not from me, from this mother. You helping her and helping her baby, because you take care of her, not only for the dispensing medicine for the sexual being health. No, you helping her to save her life and her baby life, because you get her advice in the sexual and reproductive, like a maternal or GBV or whatever these expressions of the sexual and reproductive health. Thank you so much for your time, and thank you so much for this presentation.
Thank you very much, Dr. Ali. Before I proceed to introduce our third speaker, let me remind our colleagues to please write if there is any question that you have, write them in the Q&A box. Our speakers will be more than happy to answer it for you. So we will now go to our last but definitely not the least speaker. Our third speaker has received her PharmD degree from the Lebanese University and pursued her study with marketing degree from the American University of Sciences and Technology. She is a candidate for a Doctor of Public Health degree from St. Joseph University. She founded Luna Farm Pharmacy in 2008 and manages the pharmacy herself. In September 2020, Luna was elected to the FIP Executive Committee as a member for the EXCO for Africa and the Middle East, Health in Medicine Information section. She is also a member of the FIP Community Pharmacy section, a member of the FIP Non-Communicable Diseases team, working group, and a member of the Lebanese Order of Pharmacists Scientific Committee. Currently, Luna is the adjunct preceptor of the Lebanese American University and the Lebanese International University, and for more than 20 years of experience in academic, community, and industrial settings, Luna has solid expertise in active research in different areas with multiple publications and renowned journals. So we will be hearing from Luna a case study on sexual health. Colleagues, help me welcome our speaker, Dr. Luna El Bizri, who will be presenting a case study on sexual health.
Hello, everybody. Today, I'm going to talk about how to have a strong patient in sexual and reproductive health self-care intervention. Next slide, please. But before starting my case study, I would like to tell you why community pharmacy is really the best environment for these type of patients. According to the WHO guidelines, the characteristic of the enabling environment to shape access to and use of self-care interventions are in this figure. And as you can see, all these factors are almost there in the community pharmacy. So you have a very high trained healthcare workforce. We have, of course, in the pharmacy regulated quality products and interventions. The patients will be educated with the most trustful and reliable information. We don't have any discrimination for any patients or individual coming to the pharmacy, whether for his sex or her sex, gender, cultural, social background, whatever. We do support these patients psychologically. And we do understand when we are talking about reproductive health commodity security, that when every person is able to choose, obtain, and use quality contraceptive and other essential reproductive health products whenever they need them, and this is definitely in the community pharmacy. Next slide, please. So what are our services, our sexual and reproductive health services in the community? We do offer sexual and reproductive health counseling, hormonal contraception, condoms, pregnancy and fertility services, HPV self-sampling for cervical cancer screening, and some services for sexual dysfunction. The best scenario, of course, Can you come back? The best scenario, please, of course, is when you have a private area. I should tell you that these services can differ from one country to another, or one area to another, or one region to another. Next slide, please. So what is the ultimatum goal for us? When we are doing our best in the counseling of sexual and reproductive health, we will end with a very patient who is empowered to take the best self-care intervention that is really the best for his needs and his situation. Next slide, please. So what are the pillars for this self-care intervention, and why self-care interventions are important? Because you will have a patient that is able to self-manage his condition. What does that mean? Self-medication, self-treatment, self-examination, self-injection, or self-administration. He will be able to do different self-testing like sampling, screening, diagnosing, and monitoring. Self-awareness, he or she will have the self-ability to help him or herself, to educate him herself, and to have a good efficacy for his and her choices. Next slide, please. Some examples, for instance, for the self-management, when we have self-injections for contraceptives. This, for instance, this example is well known in Africa. Another example for self-testing, for instance, the pregnancy testing kits that everybody is using. A different example for self-awareness, the ovulation predictor kits during the fertility. Next slide, please. So what are the hormonal contraceptions that we are having in the pharmacies? We do have oral contraceptive with the 3 arms, the combined oral contraceptive, the progestogen only pill, and the emergency contraceptions. We have the patches, the rings, and the injection. In Lebanon, for instance, we do have only the oral contraceptive and the ring. And between 2 brackets, the oral contraceptives are highly used, unlike the rings. Next slide, please. We do offer other services, as we have said before. In Lebanon, we offer the pregnancy and fertility services, the condoms, and services for the sexual dysfunction. Next slide, please. So before talking about my case study, it is very important to work on your barriers as a pharmacist and on the patient's barrier. What are your barriers if someone is coming to your pharmacy asking for a sexual and reproductive health help? Maybe you have lots of things, you don't have time. This is the workload. Maybe you are not you don't have incentive, you have a lack of remuneration. Maybe you are not highly trained in the sexual and reproductive health area. Please put aside your gender belief about gender difference, the acceptive, you have to accept their social or cultural acceptance. Try to have a very private area. If you don't have a consulting room, try to take a part in the pharmacy to talk to your patients, and to try to have in your country supportive policies. Next slide, please. What about the patients? What are the barriers for the patients? As Wael have said, they don't get the reliable and trustful information. They have knowledge gaps. They are gathering the information from everywhere, and maybe they cannot access easily the primary healthcare centers other than the pharmacy. You have to show them why it is really beneficial to have the decision in their sexual and reproductive health. And what is most important, to break the fear from the stigma and how they're going to be perceived. And this is one of your roles. Next slide, please. So now we're going to talk about our case study. This is a 19 years young lady who came to you panicking, asking for the morning after pill between 2 brackets. So what the first thing to do? What is important, as we have said, to really greet her in a friendly and respectful way. She doesn't have to have this fear. you have to assure to her that you are here to help her, and to try, as we have said, to have a counseling area where we respect the privacy and we reassure to her that whatever she's going to say is very confidential. Don't ask her about her marital status. Don't ask her about anything that is not related to the condition, but ask her why she wants to use these emergency contraceptions. So with the question that I'm going to ask, if she's going to ask for the emergency contraception, I just give it to her and to handle it her, and that's it? No. I would like to tell you in Lebanon that the emergency contraception is authorized to be prescribed by the pharmacist and is considered as an OTC. So what else do you need to know? Please, next slide. You have a taxonomy. You have to have in your mind a taxonomy for the emergency contraception, for the hormonal contraception as a combined, whatever you need to do when you have a question about a sexual and a reproductive health matter, you have to have in your head a taxonomy. As you know that we do have only 2 molecules in the market for the emergency contraceptions, which are the ulipristal and the levonorgestrel. Some countries have both of them. It is the case in Lebanon. Some countries, maybe they have only 1 molecule. So what is important now is really to start your counseling. One of the good questions is to ask, when was the last unprotected sexual intercourse? Because levonorgestrel will work within 72 hours, while ulipristal will work within 5 days, which is 120 hours. So the first question is to ask, is your last unprotected sexual intercourse happened before 96 hours? If it is not, we want to be sure if it happened before 120 hours, which is the 5 days. If it is more than 5 days, you have to refer your patients, because you cannot do anything in the pharmacy. She needs to put one of the best, safest contraception, emergency contraceptions, which is the IUD or the intrauterine devices. If not, you have to give the ulipristal. So if we move for the second question, yes, she had an intercourse before 4 days. So it is important to know when her ovulation has taken place, because as you know, these molecules will work best before they will break the LH surge. So if she has her ovulation before 5 days, you have the options to use whether ulipristal or levonorgestrel. But if it happens after the ovulation, you have to take care about the levonorgestrel, because you have to double the dose, because obesity can affect the efficacy of levonorgestrel. If she's not obese or she doesn't have a BMI more than 25, so you have the choice to use either of them. Next slide, please. So let's go back to our patients. We have the taxonomy in our head. So you have to ask her the 3 important questions. When was your last period? When was your last unprotected sexual intercourse? And how long is your period? You know, because you have to know the ovulation time. In our case, this lady had her unprotected intercourse 2.5 days ago. So it is within 3 days, within the 72 hours. And her last period started 9 days ago, and she has a predictable 28-day cycle. So both of the medications will work. But we opt to go to ulipristal acetate because it will offer a slight advantage. As you can see in this figure, it is slightly advantageous over levonorgestrel. So now we handle the morning after pill and then we say, thank you very much. No, we have lots of things to do before telling this lady to go home. Next slide, please. We have to be sure there is no precautions noted. Does she have uncontrolled severe asthma, a liver disease, gynecological cancer? Is she breastfeeding? Is she now actually on a method of contraception? We have to clarify this before moving on. Next slide, please. we have to tell her how to take this medicine. But what is more important, to tell her what to expect as side effects and mostly how to manage these side effects. For instance, if she fears to have a nausea, let her take it with the food. If she had a vomiting period within 3 hours after taking the tablet, let her have another dose. If she's feeling a headache, if she's feeling breast tenderness, let her take a paracetamol. So she has to be aware that she will have some experiences in changing in the bleeding patterns. So she has to expect that, not to fear, not to panic. Next slide, please. Yes, you have to take care about drug-drug interactions, because maybe you have a patient with taking anticonvulsant product, and it will reduce the efficacy of this emergency contraception. Maybe she is taking an omeprazole and she didn't tell you. And you have to know that ulipristal will work in acidic pH. So please watch for drug-drug interaction while counseling these patients. Next slide, please. Finally, your job is not finished. You have talked about the medicine, you have taken the right medicines for her, but you have to educate her now. Now, I'm going back to what Wael have said. You are, yes, a prescriber, and sometimes you are a dispenser, but what is more important, that you are an educator. You want to empower your patients. So educate her on misconceptions. They have to understand it's not an abortion pill. Some people think that emergency contraception is an abortion pill. She has to understand also it's not a regular contraception method, and it doesn't continue to protect her against pregnancy. You have to stress on the follow-up. Tell her if she has no period within 3 weeks to perform a pregnancy test. Encourage her to return to the pharmacy if she had any complications or clarifications. Now you are empowering your patients. You are guiding her to take decisions. So what else to say? You need to give her precautions after taking the pill. You have to discuss with her the importance of using a physical barrier until her next menstrual period, to advise her to use a regular contraception, and to discuss with her the risk of sexually transmitted diseases with unprotected sexual intercourse. Next slide, please. So to empower your patients, to help her to self-intervene the next time she needs an emergency contraception, it is very important to first inform her what is an emergency contraception and how and when it must be used. What is the efficacy and the failure rates? You have to explain to her when it is more effective, and to let her understand what are the side effects and how to manage them, and when she should come back for follow-up. Next slide, please. I will end with this slide because at the end, when you are doing this good counseling, you are educating your patients and you are guiding her. She will be able to self-manage her condition the next time, to do testing, for instance, a pregnancy test if she needs to, and she will be aware and educated to know what to do if she had a new unprotected sexual intercourse. Thank you very much.
Thank you very much, Dr. Lona. I'm sure our audience, our colleagues would agree with me when I say the discussions we have today has reminded us well of how important our role is in supporting self-care of our patients, not only to improve their sexual health, but the totality of their health. So at this point, let me invite our panelists. Please switch on your video. So we'd like to ask our audience if there are those who would like to ask questions. So I haven't seen any that is written in the Q&A box. So I would suppose the discussion was very clear. It was very simply presented that no questions came up. All I would see are comments that we have very good topics discussed this afternoon by our very good speakers or panelists. So I don't know, let's just take a look if there is any that has written a question. There's none. It's all thanking each one of you of a very good discussion. Very appreciative of the topics that we have this afternoon and very appreciative of how the presentation is being done. So with that, in the interest of time, I would like to sincerely thank you all, our dear panelists, for the very good discussion, very informative, very insightful. So again, the recording of this episode will be made available on www.fip.org. And please give your feedback to webinars@fip.org so we may be able to continue to improve our digital event offerings. Again, thank you so much to all of you. This is Leonie Ocampo from the Philippines, thanking our speakers, our panelists, and all of you, our fellow pharmacists, for being with us this afternoon. And I would like also to thank Mila and Chris, who's been here with us, assisting in how this webinar came to be, how it is that we have now. So again, thank you, Irene, Luna, and Wael. Thank you so much.
Thank you.
Thank you all.
Bye.
Bye-bye.